Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 27-year-old female presents for therapy because she and her new husband are having difficulty adjusting to their new roles as spouses sharing a household where both spouses work full-time. There have been some struggles with regard to household tasks, communicating expectations, and other adjustments. After identifying the patient's primary concerns, the therapist determines that interpersonal therapy is the most appropriate approach to the patient. Therapeutic techniques are likely to include any of the following except A. Role-playing, B. Communication analyses, C. Clarifying incidences, and D. Examining motivation. D is the correct answer, examining motivation. Examining motivation is an important aspect in change theory, including Lewin's change theory and the trans-theoretical model of change, as the motivation for change really is among the most important predictors of success. When you're talking about change theory, which is a different theoretical perspective, motivating forces really are important. Is the patient presenting for therapy to change because the patient really wants to, or is the patient there because an employer insists upon it, or a significant other insists upon it, or some other tangible reward is there if the patient will change? All of those suggest that the patient's internal motivation is not as important. When it comes to change theory, internal motivation, the patient's genuine personal, like intrapersonal desire to make the change, really is an important predictor of success. So when we're talking about change theory, examining motivation is enormously important. However, that's not what this question is about. This question very clearly is about interpersonal therapy. I mean, it gives you a little bit of background information about the 27-year-old female, and she just got married and they're having trouble with their roles. But the actual question is, after identifying the patient's primary concerns, the therapist determines that interpersonal therapy, capitalized, interpersonal therapy is a particular therapeutic technique. The therapist determines that interpersonal therapy is the most appropriate approach to the patient. Therapeutic techniques are likely to include any of the following except. So this really is very straightforward. Which of the following four answer choices are an exception to therapeutic techniques in interpersonal therapy? In other words, which of those four isn't typical of interpersonal therapy? And as you look at those four options, you see that role-playing, communication analyses, and clarifying incidents are all really important parts of interpersonal therapy. Remember, interpersonal therapy is, or was rather, designed as a comparatively short-term therapeutic modality. Remember that interpersonal therapy was designed for people that don't have months or years to explore therapy. Many of the other therapeutic modalities like psychoanalysis and psychodynamic therapy and even cognitive behavioral therapy, a number of other therapeutic modalities, they really take time, many, many months, if not years. But for 100+ reasons, some people don't have time. And a big part of that is that their insurer will only cover X amount of sessions of therapy annually or total or whatever. Unfortunately, contemporary insurance-based approaches to care oftentimes limit the number of therapy sessions that a patient may have. And interpersonal therapy really was designed to be a short-term solution to a very specific problem. The other piece of interpersonal therapy is that, just like the name implies, it is really based on interpersonal relationships. And so, interpersonal therapy really is based on interpersonal relationships. Is there a problem amongst the patient's interpersonal relationships? What is the problem, and how can you help the patient identify a solution to it? And so, very common techniques of interpersonal therapy include things like examining communication patterns within the relationships the patient has, whether in this case, a relationship with a new spouse, it might be a relationship with another family member, or a non-spousal significant other, or a coworker, or a boss, or whatever. But it's about examining communication patterns within interpersonal relationships, examining aspects of the relationship, both the positive and the negative aspects, role playing, communication analyses, and then very specifically trying to clarify interpersonal incidents. So when it comes to interpersonal therapy, B, C, and D, or rather, let me say that again. When it comes to interpersonal relationships, A, B, and C are all really important approaches to this particular therapeutic modality, but D is not. In other therapeutic modalities like change theory, D is very important, but that's really not the primary determinant of this one.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.